Immediate dentures are dentures that we provide immediately after teeth are extracted. And the expectations you should know about of what to expect include that they're going to feel very clumsy at first. It's going to be similar to anyone that's ever had eyeglasses. The first time they put eyeglasses on, it felt very strange. But after a few days, you get used to it and it becomes your new normal. So it's just going to feel different. It's just going to feel different for a while. There's no getting around that. And the other thing that you will experience, a couple things. One is you're probably going to develop some sore spots in some locations, which will need to be adjusted. And those sore spots can take up to 2, 3, 4, maybe even more visits in order to clear up. And every patient has a unique set of circumstances. They're all different, and there's no absolute norm of dentures or immediate dentures. And so it just takes time to take care of these things. The other thing that will happen within the first few weeks or couple months is the dentures will get loose, and that's because the bone is changing underneath the denture, which is an inevitability. And that takes up to 6 months for that to get to a point where it settles down. And by that point, we do need to do relines of the dentures to essentially refit the dentures to the new set of circumstances. Those are all to be expected. And along the way, with the loose dentures, we have ways of helping that out by doing temporary relines of the dentures so that we're essentially kind of refitting them as we go with a temporary material. But at that 6-month mark, then we use a long-lasting material that will reline the dentures. So, but those are some things. Of course, also post-op, since we're talking about extractions, the same things that we've discussed about post-op problems or expectations after extractions applies as well. You may have some swelling, and that'll certainly contribute to the denture feeling a little weird. And but I tell my patients the best thing is to go out that day and that night, wear the dentures as much as they can, wear them all night if they can, because it acts like a Band-Aid. Then after that, the dentures come out every night. You need to give your mouth a rest. And the example I use is kind of like wearing shoes all the time. If you never take off your shoes, well, let's just say your toes need to wiggle out in the sunshine once in a while. So it's a good idea to get that denture out, give your mouth a rest. Obviously, get your dentures back in during the day, that's fine, but give your mouth a rest every night from the dentures being in there all the time. Dentures worn all the time can have some negative and harmful effects.